In the prior video, I showed how to do the palpation and spring testing for a right side bent coccyx. They are extremely common. It's extremely rare to see it bend the other direction. And when the coccyx side bends to the right, so the first coccygeal segment drops down on the right side and the tip points over to the left. Some people erroneously call that left side bent, as I have done in the past, but it is actually correctly stated as right side bent because the top segment drops down to the right. Okay, but with that movement, when it gets fixated into side bending, there's also a rotational component, and this little guy's cooperating beautifully because when I push it over here, he just rotates automatically. So I'm going to reposition this skeletal model and show you how I then evaluate the rotation. I don't bother looking for it in the presence of a side bent tailbone. I treat it, I restore that motion first, and when all of the tests are then normal, then I come and again I look for the tip of the tailbone, okay, and so I know where the tip is, and then I come to both sides, just come over no more than a ½ inch, and I'll butt up against the transverse processes of the first coccygeal body. Okay, so then I come on top of it. So now my thumbs are touching each other, okay? And if it is rotated to the left, it means the front of the top coccygeal segment, CO1, is pointed to the left, so the left side is going to be more posterior, so it'll look something like this. It can be a little subtle, but most of the time it's quite overt. Okay, so we're just looking at position now. We don't treat based on position. We treat function, and every joint in the body, you should be able to load it, spring it, have it move a little bit further, and recoil with integrity. So we're now going to do a spring test on the right side. I'm going to load it, and it moves a little bit further. It's really subtle, but you'll feel the motion, and I can spring it. But if we come over onto the left side and stack thumbs, I'm trying to push down with 5 pounds of force. No movement. I cannot take up the slack. It's already taken up. I'm going to add another 5 pounds of force, then I'm going to try and spring it. It will not spring. Okay? And I would recommend that you use a postal scale and practice discerning what 5 pounds of force is pushing straight down with your thumb, with stacked thumbs, and then with the side of your thumb, because for treating the side bending component, you will capture the outside of the tailbone with one thumb and then stack. So you can practice pushing on that postal scale to appreciate 5 pounds of force. So with the rotational element, there might be, at that point, a greater amount of tone in the left sacrospinous. That stands to reason. But I honestly am new to finding the rotated tailbone. I stumbled on it very recently. I don't find it detailed in the literature. And I started looking for it when a person still had discomfort after I had corrected the side bending. But I honestly don't know how the soft tissue, how the tone of the sacrospinous would manifest. Because realize that on the right side, you know, the front of it is going to the left on the right side of the first coccygeal body. But on the left side, it's being pulled backwards also. So it's an unknown at this time, so I could only speculate. I'll do more investigation and I'll have more information later. But honestly, this is fairly new to me. And again, I haven't found that spoken about in the literature to any detail. Thank you very much.